Well, hello, everyone. This is a tough conversation we're going to be having. You saw a little taste of it in the video just now. But I am so thrilled to be here to chat with everyone here. I'm Maddie Feldman. I'm a rheumatologist in private practice in New Orleans and Vice President of Advocacy and Government Affairs for the Coalition of State Rheumatology Organizations. So I'm an advocate, but I'm also a parent and a grandparent. And my daughter was diagnosed with juvenile rheumatoid arthritis when she was 9. So I know what it's like to demand access for your child. But what I don't know and what I have not experienced is the unimaginable, what happened to Bill and Shannon. So we're going to have that conversation. It's a tough conversation to have. The slings and arrows and the obstacles to access, as we say, access denied, life denied. And that's a tough conversation. We're going to hear more about that. And the struggle and the passion and the advocacy that these two have sort of put into motion is something that we can all benefit from. So I'd like to start with Shanon. Why don't you tell us a little bit about Cole?
I appreciate that. Thank you. Hi, everyone. I'm Shanon. I'm Cole's mom. I really wanted to humanize first this panel. Cole is more than a story. He's our son. So it's important to me that everyone realize that the work you do is about human lives. Every claim that is filed, every person at the prescription counter, every patient has a family, has a life. They are not just numbers. They are not just an MRN in your EMR. They are humans. So I always like to start off by telling people about Cole. So it would mean a lot to us to share with you about who our son was and the legacy he leaves behind. Cole was a Pisces, just like me. So we're compassionate, sensitive, and dreamers. He had a very vivid imagination and knew things literally no one else even thought about. As a little boy, Cole wanted to know how bears and lions got from one continent to the other when the earth was first created. He created board games that were actually really good. He was obsessed with Legos and would create for hours on end. He asked questions and told me about things that I later had to Google because literally I had no idea. One of the things I miss most about Cole are the random texts I'd get from him. I'd smile every time his name popped up on my phone because I knew it was something that would make me laugh and sometimes cringe. As he grew up, Cole fell in love with video games. He had his own gaming streaming channel. Other people would watch him play. He loved gaming. Took me longer than I care to admit to embrace this passion of his, but he found so much joy in it. It allowed him to escape to new places, new dimensions, and explore. These are the same reasons he also loved movies. Cole was the first in line on Tuesday $5 movie night to see the newest movies. He was a dreamer. He wanted to see the world. He wanted to be a millionaire and be an entrepreneur. So he could explore and live freely. He was a modern-day hippie, if you will. He wanted freedom for all of us. He didn't see the need for restriction, rules, or enforcement. Life is love, he once told my girlfriends and I as we were contemplating the meaning of life over cocktails. Ironically, this little hippie of ours struggled through childhood with significant anger management issues. Perhaps it was undiagnosed ADHD. Perhaps it was his little free mind trying to escape the constraints of societal rules. We don't know. But it was hard for him. School was hard, rules were hard, life was hard. He fell into a severe depression in his late teens. There were a couple of years we feared Cole would end his own life. He didn't like being on this earth. He couldn't find his own happiness. It was a heartbreaking and trying time for him and us. But Cole finally completed a mental health assessment, was properly diagnosed and medicated. I remember once when Cole was having issues getting his ADHD medication because of insurance, he texted me saying, "I just want to feel normal. Normal." My sweet boy had finally found his happiness. He moved out and moved in with his childhood and best friend, was working full time, and he was happy. Something we had truly hoped for months, in years, joy, seeing him smile, vacationing with him in happiness, spending holidays with him, feeling true exuberance brought so much joy to us. We had our Cole back. Our happy, curious dreamer boy was back. It may seem twisted and dark, but I am grateful that Cole found his happiness before he passed. I don't know that I would be able to keep living had he left this earth with the anger and sadness his heart once carried. Knowing that he realized joy, that I can so vividly see his genuine smile, him being healthy and happy, brings me a sense of peace that I can't explain. We'll never understand why he had to leave this earth at the age of 22, just as he was at the peak of his life, just as he was finding his way. But I am thankful that he found his true self before he departed. You see, Cole walked into a chain pharmacy on January 10th, 2024, to pick up his Advair, a medication he had been on for years for his asthma. We typically paid anywhere from $30 to $65 a month for his Advair, depending on our plan. Unbeknownst to us, when Cole went to the pharmacy on January 10th, 2024, he was told it was no longer covered by insurance. He was given a price tag of $539.18. At 22 years old, making $19 an hour, that wasn't a reasonable cost for Cole. He was not given an alternative. He was not provided with a plan to get his medicine. He simply left with a rescue inhaler, meant not to prevent asthma attacks, but an attempt to rescue him after an attack began. 5 days later, that rescue inhaler was empty. Our son was rushed to an emergency room by his best friend. He was having a severe asthma attack. He went into cardiac arrest in the car on the way to the ER and arrived at the hospital lifeless and pulseless. We received a phone call on January 15th, 2024 that forever changed our lives. Our son was on a ventilator and in the ICU. We had no idea how this had happened. Our sweet, amazing boy didn't have his Advair, his best friend told us. When we questioned further, trying to understand, his friend said the pharmacy told him it was like $500. We still did not understand how this could have happened. Our beautiful son passed away 6 days later on January 21st, 2024, at 10:06 p.m. Bill and I later learned, only through the compassionate and hard work that our independent hometown pharmacist in Lodi, Wisconsin does, that Cole's pharmacy benefit manager had removed Advair from his formulary for no medical reason. They had removed it simply because it no longer profited them. The chain pharmacy Cole went to on January 10th did not see Cole as a human being who they needed to help or offer a solution to or an alternative to or make a phone call for. He was just another person in line. Our son's life didn't have a price tag. Your life, my life, our loved ones' lives do not have price tags. It is through Cole's legacy that we advocate for PBM reform, access to affordable health care for all, and removing the barriers that the top pharmacy benefit managers put in front of us solely for their own pockets. Grief has both destroyed us and also given us hope. I'm not a particularly religious person, but I do believe in kindness and spirituality and paying it forward. Cole had told me once that he wanted a tattoo of an elephant or a lion because both are wise, loyal, and strong. And I couldn't describe our son better. Bill and I are here today to carry on Cole's legacy by giving a voice to those that continue to face the barriers that he did. Receiving affordable, life-saving medication from a pharmacy of your choice and having equitable access to health care is not a privilege given to some. It's a right that we all have. Yeah.
Having patients whipsawed, that's what my patients undergo, whipsawed back and forth 3 and 4 times a year on different kinds of medications without being notified. Dan, were you notified? And then we're going to move over to Elizabeth to talk about, do you see this often? I mean, this tragedy that happened to you, is this the one time this has happened? Dan and Elizabeth, you two can take this. Go for it.
Oh, yeah. Well, you know, after the independent pharmacist did what a pharmacist should do and care for the patient and provide me with my medicine as it opened up, you know, Pandora's box that day. That was about maybe a month after Cole passed away or so, a few weeks, yeah.
just to explain, I had gone to the pharmacy to pick up Bill's prescription. Bill and Cole had the same asthma, same prescription, same insurance. So everything was the same. And when I had gone to our local independent pharmacy to pick up Bill's prescription, I got that same note that said it no longer covered by insurance, right? The big difference is that our independent pharmacist takes that minute to just stop for a second and not look at us just as another person in line, but said, you're not leaving with nothing. You're going home with something for him. And took those few minutes to make sure I left with something. And it was leaving there that I was like, oh my God.
Neither of you were notified 30 days, 60 days, nor the physician was notified?
I worked for the same company, had the same insurance. I know I wasn't 100% notified in any way. Cole was not notified from everything that we could see.
Yeah.
And his physician definitely was not notified.
Elizabeth, how often do we see this happening in asthma?
First things first, on behalf of the asthma community, I'm so sorry for what you guys went through, because there's other asthma advocates out here. And this happens every single day, multiple times a day. In 2024 alone, there was over 3,900 deaths from asthma attacks in the US and over 6,000 globally. For stories that came out about I couldn't afford my inhaler in past, there was 20 cases last year that made the news in some form or fashion, whether that was local or national. And the formularies change quickly, and especially in the month of January. And I'm gonna call credit to pharmacists, right? You guys have an extraordinary education. You're also held to your job. There's metrics. You've got to do so many things, and it's such a human crisis that we can't give as healthcare workers the time needed to these patients. And I know everyone in this room was like, their jaws are on the floor because I'm the same way. And this was intentional. I haven't talked to them till today. So there are better ways these things can be done. There are so many solutions for affordability and access. And the problem is, I didn't know about them till I met Melissa, until I met the rest of this community. They're not shared enough. They're not talked about enough. There's not enough understanding of how to write a strong letter of medical necessity or an appeal. And yeah, there's these cookie cutter solutions we see out there that's very generic, but you just described your son in the most human way. We have to get that human piece into healthcare. We're not just boxes to check.
And that brings me to the advocacy part. I mean, everybody here has heard of NMS, right? Non-medical switching, which is basically switching the formulary for the profit of he who creates the formulary. I mean, let's just face it, that's what it's about. When was your aha moment that turned the sadness and grief into passion, persistence, and advocacy?
And give them the real story on that one.
Well, reality is Shannon came home from that pharmacy that day, and we were still just absorbing, holy shit, this is what happened to our son.
Yeah, I mean, we're, in the midst of grief. It was 3 weeks after, I think it was 3 weeks after Cole had passed.
I mean, you didn't even know at first that he would have been turned down at
No, all we knew is that he couldn't get his Advair and it was very expensive. That we didn't know why, we didn't know anything more than that. So we were still just trying to just grapple with what has happened. And I walked in the door and kind of told him what had happened at the local pharmacy.
Well, and honestly, we had a little conversation, broke down, and if you would know, Shannon and I were, have potty mouths, if you want to say.
Yep.
And reality of it is like, I don't remember if she said it, I said, she's like, this just fucking can't happen again. We got to fix this or do something. That's like, that was really the true aha moment. And it was about 4 days later, I got introduced by the pharmacist that Shanon had saw that day for me. She contacted their founder of their pharmacy chain, and he was heavily involved in, we didn't know what a PBM, I should say, so you guys know this. He was heavily involved in PBM reform at that time. And it was about 2 days later he came to our house, and that's when it really started. We learned about what the top pharmacy benefit managers are doing, and the gentleman we learned from his name is Dan. He's in attendance today. I don't see him out there. Okay.
I can't see him.
Dan's here.
First, he taught us what a pharmacy benefit manager is.
Yeah.
Because we had no idea. But sat at our kitchen table and provided a few hours of education.
Like literally that couple, 3 hours was crazy.
Yeah.
A couple things happened that day though. I know from Dan's side, he met us, we met him, and we were like just attached at that point because he almost had like a solution for us because we were so looking for what can we do. You know, I sold truck parts and she was a social worker. I mean, like, and we've all had asthma in our life, so we've played step processes, this and that. And the simple reality is we got to fix it. Like we said in the living room that day, and I didn't know a damn thing about this, nothing. Well, good thing we had Dan fighting PBM reform and his whiteboard at his house, and just learning everything to know about everything. Is what I had to do. And I'm about 17, 18 months into this mission now, and a lot from Dan, just heavily versed in this. And we have started a pretty big, big movement, and Dan helped us start that.
So you learned about formulary construction. I wrote an article 6 years ago, Formulary Construction in America, perfectly legal and perfectly wrong. And this is the ultimate, this is the ultimate sacrifice that we're all making to continue this same process. So you've started off sort of locally and you've moved nationally and really have pushed this, the wrongness of formulary construction forward.
And we'll say it to keep it like kind of as to what it is. This is Cole's voice. I mean, he always stood up for the little guy. He really did. And we're going to do that for them. And what we've started in the state of Wisconsin in particular, one of our first things was meeting with the senator, our Speaker of the House, who could call an executive session. We met with the governor's office, asked for a special session, and got denied. And we've learned why and all that kind of stuff with lobby money. And that blew my mind because I didn't get this lobbying stuff. I'm not political. And breaking through those barriers. Well, as we were just kind of gearing up, I was learning about the failed PBM reform bill that we had in Wisconsin. Actually, in 2024, we had a failed one. It didn't even get called for vote, and predominantly a couple years earlier, that's when Dan was really working on 105 co-sponsors. We had 133 people in our total elected officials in Wisconsin. I had 105 that agreed we need PBM reform, and Dan was taking this with his pharmacies throughout Wisconsin, which are all independent, owners and whatnot. They were fighting for PBM reform, and there was a game played the whole way to get the votes and this, and the final vote, as Dan explains it. And now if you stop by our booth today, we can definitely let you know this. But last 18 hours, it got stripped. I mean, stripped. It was a robust bill. It was stripped because of the influence that we saw from the lobby groups. And
just common sense, isn't it? A patient is stable on medication, and their condition is being controlled, and then why would you want to take them off of the medicine that has made them took care of the condition?
And that's exactly what we thought. So I dug into it a little bit. Good news was it happened to me. So I figured some stuff out and figured out the patent expiration of Advair possibly, and then the replacement of the Advair HFA, and talked to some people that, a lot smarter than me, that kind of explained why it happened. And then I learned about the rebates, the rebate games that are played to get the better placement. And that was a classic example of that, in my opinion, because there was one of the generic alternatives of Alexa or the Flotinazolate or whatever was a tier 4 with a prior auth and a quantity limit, but you had to go through the Advair HFA first to get it because of the profit center that happens.
We're talking about a drug pricing crisis in the United States, and yet he who creates the formulary takes the highest priced drugs and puts them on the first tier, and the generics, if you're lucky, are not even on the formulary because you can, if your income is a % of the list price of the drug, why would you put a $500 a month drug on when you can put a $2,000 a month drug on?
And just think about that little scenario at that counter too. So it was January 10th, Cole walked in, got told your Advair is not covered. We all think, okay, why couldn't he contact his doctor and get authorizations and things? But reality is it was Wednesday evening. We had a really good doctor's office. I always have felt that. But figured 24, 48 hours probably to get your response. And we all know what happens when you put a prior authorization in for anything. Generally, it's going to take more than a day, if not 7, 10, 2 weeks. We had 6 total days, including, actually 5 days, including a weekend. I mean, Cole was set up for failure. They took this off the formulary, didn't tell him. The processes we have in place are manipulated by big healthcare, we'll say, big PBMs with the denials and all that stuff, and the overwhelmingness at the local doctor's office that they can't turn and burn every single time. I mean, he was just set up for failure.
Elizabeth, you're sort of a prior auth specialist. What have you found over the years? Is it getting harder, getting easier?
It's getting harder, and science is changing. There are better medications coming to market and newer medications, and it's really tough to keep up with the formularies. And I come from the private practice world, and the cost to keep our doors open, right? We're talking keep the lights on, keep, staff happy, all of this kind of stuff. It all adds up. And so to hire, especially in a PCP situation, in a specialist's office, you typically have your medication access coordinators or, biologic coordinators. But it is tough. Every prescription that we send over to the pharmacy, it's one of those, especially when you get into inhalers and nose sprays, it's all right, let's see what's going to come back. Chances are this one's not covered. It just happens so frequently, and it gets more and more complex. And physicians and practices not investing in the role of a coordinator to oversee this, so somebody's putting hands on it, somebody who can talk to the pharmacists, have that point of contact. We're in healthcare, guys. It is 2025, and we still use faxes. I don't care that they're electronic faxes. We still fax things.
Right.
Yeah.
So do faxes always go through? No. So there's other technology challenges that come into this, and my heart breaks for every single patient affected. My dad had Parkinson's. I had no idea back when I helped him with his medications that this was a thing. Now it's my job, and unrelated, but now it's my job. And so the fact that it happens so often, I'm sure your hearts are heavy with this panel, but my real, what you guys should think of is this happens so frequently. Tell your friends who are coordinators. Tell your friends' friends. There are ways we can help, and there are ways we can do this. We can't change, how many scripts an hour a pharmacist can fill, but we can answer the phone when they call. So there's ways for us. Let this enrage you, 1. 2, but also let it enlighten you that it's bigger than us. It's bigger than just our day-to-day. And I know we're overwhelmed. I know that when you walk back into your offices next week, there's going to be a stack of faxes about this thick of prior auths and things like that to look at. But
that's just one. I have backstage a 30-page prior auth from CVS Caremark for 30 pages. And sure, we pass these laws, it has to be electronic, but you still have 30 pages to go through. So I'm going to be honest, I haven't been particularly happy with the streamlining of the prior auth.
And then we could talk about gold cards. There's so many things. It's one of those that one of my favorite mottos is embrace the suck. And as a healthcare worker in the prior auth space, I just have to embrace the suck of what it is. But there is a patient at the end of every button I click, pen stroke I write, fax that I either electronically or some stand over fax machine still and send.
So what can we do? What's Cole's Act? Tell me.
Yeah. So, as you mentioned in Enrage, so we kind of got that. Me and Dan put our heads together. We started a foundation called Patient Protector. We're going to tell you the story. You're going to get enraged. We'll educate you and show you how to engage. Those 3 things. That's what I live for at this point. One of the biggest things we really pushed for, meeting with the Speaker of the House, the governor, and knowing that was going nowhere. We put our heads together and started working with some of our elected officials, got the Senate president for the 25 term, who is out of healthcare and was a big supporter of it, and worked with them to bring a bill to the state of Wisconsin for very comprehensive PBM, top pharmacy benefit, or pharmacy benefit manager reform called Cole's Act. And we're in process in Wisconsin right now. We've passed our Senate committees. Health and Aging passed it unanimously the other day. We're working on our assembly, and we're hoping to have a vote this year sometime. But if you're in Wisconsin, we need your help, plain and simple. You go to Patient Protector. We said
what would Cole's Act do?
Oh, Cole's Act. Oh gosh. Well, number 1, it's going to stop mid-year just random mid-year or formulary changes. It's going to be very regulated when that formulary change can happen, and there's got to be very specific reasons for it to happen.
Notification?
Yeah, notification goes to, I believe, 90 days.
Okay.
And really, you can't switch the formulary mid-year unless there's a really good reason. That's one of them right there. That's like one of the biggest things for us that would have probably prevented that. It does dabble into the under reimbursement world of pharmacies. Because, and this is a little fun fact, so Shanon walked out that day after that pharmacist worked really hard to get me medicine so I had something. She lost money doing that, by the way, because that HFA is under reimbursed by the contract she's in. So, I mean, and that happens every day. This would stop that too. Well, help alleviate that in Wisconsin. There's 340B protections because you see everything that's happening across this country and who's currently under investigation right now for messing with Medicaid again. You know, it's another big top health conglomerate in this country, and you know, FTC, DOJ is looking at it again, and you know, it's kind of becoming routine.
And you know, what I've found,
that's the meat and potatoes of Cole's Act.
Opposition to something like, and usually whether it's PCMA or individual PBMs come, and it's the standard thing. They go, you pass this law, prices are going to skyrocket and premiums are going to skyrocket. That's the only thing that they can say against it. Or sometimes they say, well, you want us to do a frozen formulary. You know, if a drug gets taken off the market, we won't be able to take it off. No one's ever saying any of those kinds of things. So we've looked at, in some cases, the states that have passed some of these PBM reform laws. Premiums haven't gone up. Drug prices haven't gone up. So it's, you know, that type of evidence that can rebut some of the opposition. I mean, what does the Cole's Act look like? Do you think it'll...
We're going to get the right amount of support for it, and it's going to take the voices of Wisconsinites to overcome the elected officials in our state. That's the reality of it. When we went to the table before we got involved with 105 co-sponsors.
Wow.
And getting it stripped at the end, that is very well
because
known.
of...
Yeah. Oh, yeah. Well, for example, part of our mission at Patient Protector is, well, I'm going to say this started with me. You know, I'm just me in Wisconsin with my wife, and I don't know people. I didn't really do social media, so I had to start social media. There's a persona out there, Angry Dad now, and I've started that, and it kind of took off. And that's the part that got me working with PBM Accountability Project, got me with the Federal Trade Commission, the Department of Justice. We both have visited and testified, antitrust divisions. And I got to say this, the word PBM, when Dan was at our kitchen table that one night, like no idea. And for the next 6 months, we really, 1 out of 30 people might have known. I do think that we're a little bit better now. I don't think we're there yet as far as people knowing what a PBM is, but that's a little win that we got. We're starting to do that education out there. You know, Patient Protector does reach out to across this nation. Like me, I travel, I've worked with Illinois, Texas, Missouri, just many different states, and a couple of them have passed PBM reform, Illinois most recently. And then the federal level is where we got really involved once we started working with PBM Accountability Project and NCPA, and we helped introduce the Pharmacists Fight Back Act last year with Jake Auchincloss and Diana Harshbarger in Washington, and we put our heart and soul into that to watch it die. Imagine that again. But we're still on the mission.
Same with what? Patients before monopolies, which would make the mothership and PBMs divest themselves of the pharmacies.
Well, and everything
that's bicameral and bipartisan support.
Well, yeah, and everything we're hearing, we're going to see potentially a very historic September. Pharmacists Fight Back Act is going to strategically come back, we're being told. The Monopolies Act, we're being told, and that would be very comprehensive for what we need at a national level. But once again, I'm working with these legislators. They say we need to hear from the voices of the people. We need to hear from you out here and your friends.
That's March to a Million?
Yeah, well, I say we launched, yeah, exactly.
What is March to a Million?
So we launched a campaign on July 4th, and it's going to pick up a little bit more. It's called the March to a Million Voices. And what we do for you there, simply go to my website, patientprotector.us, click the golden ticket. It'll take you 2 minutes to fill out this information. You can choose to send an email to your legislator, already pre-written. You can get a script for a phone call, or you can tweet about it, or put an X on post. It's all pre-generated, and you can even put a personalized message on there. 2 minutes, you can help be engaged. So educate, or enrage, engage, and educate. You know, I mean, it's all right there. And we need the national movement to take off. One thing we did do on that national movement, we created a docu-series. Patient Protector worked with some very talented producers. It's called The Modern Medical Mafia. It made it to, we had it on Amazon Prime, we had it on Vimeo. And then, surprise, surprise, somebody got a 16-page letter from a healthcare lawyer, and it was off Prime, and then it was off Vimeo. We still survived. We're on YouTube, and we're the first day that all happened. Well, what happened? We got shut down, and then the New York Times picked up the story, and that really helped us a lot because we weren't the producers at Modern Medical Mafia were not afraid to push this because this documentary is true. It is true. I mean, like, there's just no falsehoods in it. I mean, it's not possible because it's people like us talking, telling our story, elected officials, everything.
If you didn't have your pitchforks out before you watched it, once you watch it, you'll get your pitchforks out.
Well, and it's the first episode's out. It's on YouTube. MMM docu-series is how you can find it. You go to Patient Protector. There's a big red box. You click it. It'll take you right to it. You can watch it there. There'll be I think right now we have planned 5 more episodes. The first episode is it's 2 hours almost. It's just boom, information. The next episodes will be less than 30 minutes. But what we did to supplement this, the producers did, there's about 60 or 70 1 to 2 minute videos on that YouTube site that will educate you on anything you want to know, professionally made. It's engaging and simple to watch. And you want to learn about anything, ERISA or denials or rebates or anything. We have all the education for you. It's all available at through Patient Protector, or go to the Modern Medical Mafia YouTube page. And those are the 2 biggest social media things. But that golden ticket is what we need help with. And you stopped by the booth today, Cole's Corner 400. Look for that little blue sign right there. If you're in Wisconsin, you're going to scan something like this, and that'll take you to that little page. You can make your voice known in Wisconsin. And we got one for the national level. And, we really hope that everybody knows at least one other person, if not a whole family, when we're done here today. And we're all motivated and charged up to get out there and get people to, click that button. Just click the button and get voices.
I was going to say, Elizabeth, you and I were talking backstage about we need more physicians out there. I mean, the fact that all of you are here, we know that you've got the passion and the advocacy. What do we need to do?
Oh my gosh, there's so much. So one of the things, if you've been a repeat attendee of the Healthcare Advocate Summit, you know that we champion $4, right, for hospital charitable assistance. That we've been with them since year 1, right? And that organization has grown. They just crossed their $100 million mark in patient relief. And so the individuals that are here believe in advocacy, and everyone here has such a bigger purpose, right? You're great at what you do in your jobs, but spreading the word of a cause like this and a case like this. And I think one of my favorite things in a tragic situation like this is that, yes, there's PBM issues. Yes, there is a whole business of healthcare that you as coordinators and whatever your title is, understanding what those are and how much bigger it is than us is so important. But I love that you guys are approaching this like, again, you're embracing the suck, as I like to say. Like, this is a problem. Let's do something about it. Let's open this communication, raise voices together. It's a very positive way from a tragedy. And instead of, if you don't like the PBM, oh, I hate them, this isn't going to work. It's, here's what we should do to reform it. Here's how we'll uphold it. You've brought solutions and ideas to something that we're all banging our head against the wall on. And, I hate that it takes a tragedy to stem, what comes next. But I hadn't heard all that stuff about your son, right? And I think that's what I have patients write letters. When I can get something approved, I'm like, tell them you can't walk to the mailbox without your inhaler. Tell them you can't get on the floor and play with your grandkids because of this. Those human elements, it gets lost in business.
Totally lost. As a rheumatologist, I try to explain to an insurance company, how do you explain to an insurance company that a mother can't hold her child? How do you explain to an insurance company that a father can't walk his daughter down the aisle? These are everyday things that happen thousands upon thousands upon thousands, no matter what chronic illness or acute illness you're talking about. Those are the kind of things that matter most in life, and the ultimate sacrifice is what happened to Cole.
Well, and to say that ultimate sacrifice has put Shanon and I on a mission. I mean, like that we are so truly hearted for this. I mean, like I had quit my job actually to do this, and I'm not going to name names, but I might have started to work for a transparent pharmacy benefit manager where I can see that this is done properly. And it can happen out there. So these PBMs can coexist and things can be done properly if you're not greedy and you're not a public traded company, for example. So like, I mean, that was a commitment I made. 20 years in my business industry, 18 months of education, and actually it was 12 months of education, and I hit a position there that I'm director of patient experience for a public benefit corporation, a PBM out there. And
After selling trucks
for 20 years. Yeah.
Semi something?
So that's my level of commitment, but I mean, like, we are all in. I mean, I'm working a newer project with, we can't, kind of that can't beat it. Let's just find a way to kind of overcome it. For asthma, I got approached by a company, they're, I think, booth 500 here today, claimable. But the reality is they've done a lot of stuff in the fighting denials and whatever. But working with one of their co-founders who's a severe asthmatic and has been denied his medication many, many times, they took the time to build the technology to fight denials. And we just launched it the other day, and it's going to get bigger and better. We've got some more big news coming from it where it's going to be more accessible to people, but right now there's 14 different medications that if you get to that level, and the thing is, this is happening at the pharmacy, so that's the struggle we have. You're probably not going to start a prior authorization and this at that level, but we're going to partner with independent pharmacies to give them paths and everything, and to work this new claimable asthma appeal process. But that's another big, huge win for us.
And I wouldn't be doing my job if I didn't say what a great place to have one to talk about something like that. I'm familiar with Claimable as well. You've got a room full of people who can give feedback, right? These are the individuals that write these letters, and to be able to say, okay, tweak this, change this sentence, this needs to go in there, so that it is a community work of like, this is what's going to be the best. I mean, Claimable's smart. Like, they're going to get feedback and they know it. And I think that, for you guys to also find a community of people who just want to help. And so I actually have a question for you, Shanon. Being a social worker, right, you come across so many different types of access barriers and all that. How has all of this impacted what you do for work now?
Yeah, great question.
Yeah, that wasn't planned, sorry.
Yeah, that wasn't planned. It has a little bit of both. One, it has frustrated me to all ends of the earth because I know what the possible outcome could be when we don't have the right access we need for our patients. Yeah. I currently work in a hospital. Again, with Bill, like Bill said, I worked in corrections and community social work for years and years, and then after Cole passed, I wanted to be part of. We had an amazing experience despite our outcome, obviously, with the hospital staff, where Cole was, and I was like, that's what I want to be a part of, is nursing, and I don't want to be a nurse, but I want to work with nurses and doctors and all the things. Anyway, but now seeing, the prior authorizations for nursing home stays that they don't have an option but to go to a nursing home. But now we have to wait for a prior authorization that could take days, and now they're sitting in the hospital when they're medically cleared to go. It's very, very, very frustrating. At the same time, working with people like all of you sitting here, it's also very empowering to know that, and I work with an amazing team of social workers too, that care so much about wanting what's best for the humans that we work with and see them as humans and not just a face sheet or a
Yep.
I mean, the fact that we have surgeons in the middle of surgery being called out to get a prior authorization for their breast cancer patient to stay over that night. The surgeon didn't come out to talk to the insurance company, will remain unnamed, and it was still denied. And how can we have Congress seeing something like that happening and not be outraged?
Right.
And not go, we can't, is this really health insurance? Or is this just a profit machine for 3 big vertically integrated behemoths?
And if you learn the history of prior auth, right? I'm a history nerd. And why it was started, how it was started. It started with hospitals and how it has changed over the years and kind of evolved into what it is today. I get it. Like, I get everybody has to make a buck. I understand it. And I hate understanding it because I'm clinical. I take care of the humans. I get it. But I think that, the way you guys are approaching this with not just reform of PBMs, but the whole process, it's really what needs to have happen. And, it is a volatile time in healthcare. There's so much going on and change and grants, and I could go on for days. But to bring something up like this, if we're going to make one change, we might as well start making some more. So I just think there's no perfect time.
Yeah.
But if there has to be a crappy time, to pull this one in and to start working on this, way to seize the moment there.
So I'd like to close with you guys telling us all what would Cole think about this? How would Cole approach this, knowing the quirky, funny, happy Cole that
would he
we'd
judge
like
that
to remember?
docuseries? Would he be nitpicking that and picking it apart
Yeah.
how it was done, since he liked movies and all that? I'm guessing he'd have.
He would probably be up there
wanted-
turning it into a video game.
Yeah,
so,
he would have wanted more superheroes
Yeah, so
and-
tell us.
Got it.
Tell us,
Got it.
Yeah, costumes.
Tell
I
us
don't know.
about that.
Yes, he would have wanted superheroes and I don't know what else because I don't play video games. But he was definitely he didn't shy away from speaking out. Wasn't always, proper. And in school that wasn't always, that was sometimes frowned upon. But he wasn't afraid to speak out. And when he didn't think something was right, there always had to be a purpose.
Purpose driven.
He wasn't just going to take a class, even though it was required for graduation, unless he saw, what am I going to use this for? What is the purpose, right? So he was, there had to be a reason. And I guess I never really thought about it until I'm saying this out loud, but that's part of why we do what we do, right? Is because this cannot have just happened. We will not allow this to just have happened.
The phrase is not die in vain.
Yeah, absolutely. Again, going back to standing in our living room and when I came home from trying to get his prescription and realizing what? This is why my child died? Absolutely not. This can never fucking happen again.
Yeah.
Yeah. So, yeah. Cole was a swearer. I can't imagine where he got it from, but but he also, there are times where I can hear his voice. And that day, I can hear him, sorry, I'm going to say the F word again. I really apologize to him.
Totally fine.
But I can hear him saying, are you fucking kidding me? I can hear him saying, this is why my prescription was $500? Because it profited you? Because I couldn't breathe because you wanted to profit off of a different... he would be so appalled that this was about money. And he loved money. He loved money. He loved a good bargain. But he would be appalled. And for those reasons, that's why we are no, we will not stop until there is a solution to this.
Yeah, we can't have people dying for the obscene profits that are...
Breathing is not optional.
Well, and just simply, Cole is one.
Right.
One of at least 20,
Right.
20 documented
confirmed to the similar situation with 3,900
Yeah,
other
deaths
asthma
total.
deaths across this country, and how many were attributed to some form of this whole
Barrier.
non-broken, working as designed plan.
Yeah.
Yep.
Utilization management.
Yeah.
Should get that tattooed on my forehead because that's where I spend most of my time talking to someone. But I can't, the fact that we got in touch with you guys and were able to get together, and Dr. Feldman, you're just fantastic. Thank you for being here. And I know that you're going to get stopped a million times by this crowd. One, for probably hugs, sorry ahead of time. And two, just, you know, it's hard to say I'm sorry. We don't know what else to say, but how can we help you in your fight? That's how we can help you guys. And you're going to get a lot of that, so be prepared.
Yeah, stop at the booth today. Stop at the
Cole's
booth. Get to
Corner.
look. No, Cole. What's our booth number? 400. Booth 400. We're right by Access Theater. And if you live in Wisconsin, we got a mission. And if you live across the nation, we got a mission. And you know, someone else spent $48 million lobbying against us this year, and I don't have that. And I don't think if we all collectively wanted to put that in a pot, we don't have that. But that was top 3 PMs, American AH or AAIP or whatever, and PCMA. Those people spent money to shut us down already this year. And the only thing we got is that voice, and you can sign up at the booth today.
Perfect. Thank you
Thank
guys
you.
so much.
Oh, yeah. Thank you. Thank you.
Oh, goodness. Now they're going to play the video with you. Makes them cry. So.
Yeah.
Play the video and we'll head on down.
March winds carried in a soul so bright, born to Bill and Shanon on a lacrosse night. Tiny hands with the mighty plan, Mr. Independent from the moment he began. Cartoons on, oranges in hand, milk from the fridge, didn't need a hand. Kindergarten goodbye, he turned to say, it's okay, Mom, I'll find my way. And he danced to his own beat, a wild heart, a mind so deep, asking how bears cross the ocean blue, finding wonder in what most never knew. He lived life loud, he lived it true. We were the lucky ones who got to love you.